Hi everyone, how are you? I'll take that as a good. I see it's Tom Breen's day off here. How are you, Sam? Good to see you,
Doing
Brian.
well, thank you.
Welcome. Welcome. Happy to have you here. Let's just dive in. I have a few updates, and then I'm going to hand it over to Director Bond for a few updates, and then hand it over to Dr. Dalal for a few updates. We have a total of 992 cases that are confirmed COVID positive in the city and 27 fatalities. As we always say, there's probably more cases than that number 992 reflects, but that's the current confirmed cases. I was actually just at the CVS testing facility with the governor, looking at how the system is run. And frankly, the fact that that site was put up in just a matter of days is incredible. There are about maybe 100 cars that are flowing through 4 different lanes to be tested. I think there's a little bit longer wait than we would like, but it's an indication that there's so many people that are anxious to get testing results. National Guard is on site, state troopers are on site, New Haven police are on site, and I'm very proud of the work that's being done by our state, the support of the governor to stand up this site, and also very proud in particular of New Haven Police and our emergency operations crew and Rick Fontana for just dropping everything and making sure that this facility is up and running so quickly. Testing is key to us conquering this virus in the long run, and so this is a statement by the governor that he understands this. And we're grateful that New Haven has been chosen as this site, but also very proud that New Haven is a site where so many people around the state are able to come and get tested. A couple of other quick updates. We have 16 positive firefighter tests or COVID tests. That's up by a couple from yesterday. Police department remains at 6 positive cases of COVID-19. There are 19 firefighters out of work right now, and 22 firefighters that are at UNH. This is a question that often comes up from the press. 11 police officers are out right now, and 3 at UNH. I think it's a really good sign that the numbers have not significantly risen within our first responder ranks as far as positive cases. And that shows that both the fire chief and the police chief are working hard to change some of their procedures to reduce the exposure of officers. We want to protect our police and firefighters and police officers, not only because we care deeply about them, but also it helps us have more people on the job to respond to the public. Why don't I hand it over to Director Bond to give some updates as well.
So good afternoon, everyone. We continue to monitor and do surveillance of various special populations for this pandemic. We are closely monitoring, with that being said, the nursing homes, and we get daily updates with the nursing home just to assess the situations within each of them. So currently at Grimes, we have the total of residents that are inpatient there, 58, and then a staff total of 18 that tested positive. Within the residents, some are recovering, but that is the current number as now. They are steady. Mary Wade, also we have within their residential side, 12 positives. Within their Kimberly side, we had 16 within the long-term care facility side, the skilled nurse facility side, with 12 positive employees. With Regal Care, we have 13 positive cases of residents and a total of 6 staff employees that tested positive. And so that is currently what's happening in regards to the nursing homes within New Haven that we're closely monitoring. And just to mention that the Connecticut Department of Public Health will also be publishing weekly reports on each Thursday, and the number will vary as people do recover or we have untimely deaths. So the numbers will fluctuate, but that is the number as of today.
Thank you, Director Bond. And we've been getting a lot of obviously questions and concerns about how this is impacting people in New Haven economically. Obviously, many small businesses are heavily impacted. A lot of people have lost their jobs. There's been a decent amount of subsidies coming from the federal government and the state, but sometimes that can be confusing for people. And so that we've stood up the Financial Empowerment Center to help facilitate and answer some questions. And so I'd like to hand it over to Dr. Dalal to talk a little bit about that.
All right, thank you, Mayor, and thank you. Good afternoon, everybody. I'm just going to say something briefly about our Financial Empowerment Center. Uh, this is a service that we have been working on over the last couple of years to stand up. And when COVID hit, we kind of retrenched and redesigned our program so that it could be offered virtually. So I'm happy to announce today that we are launching the virtual version of our financial empowerment work. This program is really designed for those who are, struggling financially, which, is a growing number of individuals and families, as we now know. So it is really tailored to those who are hard hit from this crisis. And I hope individuals and families can take advantage of it. I'll just say a few words about what it is and the model. One, this is really individualized coaching and counseling to help folks through their, very specific financial issues. It is delivered by a professionally trained, certified financial counselor, and importantly, we've all seen over the years that there's been a lot of abuse and fraud in the financial services arena. This is a operation that is run out of the Community Services Administration. It's part of city government and is run through a public service mission. So these are neutral advisors. They don't have anything to gain beyond the salary that we pay them from the grant that we receive to put on the service. What are some of the services that they offer? Again, it's tailored, but basic help with budgeting, setting financial goals, tracking finances and cash flow. Basics around how to conduct banking. I think especially important now that we want to help people move to virtual banking. Understanding what housing and housing related costs really are and building those into the budget. Again, as you know, housing has been a longstanding concern. The concerns around housing and housing affordability will only be amplified as a result of this crisis. And we want to make sure our residents, especially those who are struggling financially, understand what their housing costs, both the short-term and long-term, actually are. Managing and understanding debt is very important for many of our population who do find themselves in debt for various reasons. So understanding how best to manage that debt so that doesn't dig themselves deeper into a financial hole. That's another focus area that we can offer at the Financial Empowerment Center. And finally, there are many resources and initiatives coming down the pike, as the mayor had mentioned, that are hard to keep track of necessarily, particularly if you're not plugged in, very dialed into the all the initiatives and resources available coming down the pike. So we can play a role in connecting individuals and families to resources. And I'll just give an example. There's the economic impact payment, which is available to individuals who have not filed taxes. So of course, some of these benefits are tied to previous year tax returns, but there's a benefit for those who haven't filed taxes either. And we have to navigate folks on how exactly best to access that. So all of those services will be offered through the virtual Financial Empowerment Center that we're standing up. So the number to call is up there. It's sort of small on the screen there, so I will repeat it here. It's 203-946-8523. Again, that's 203-946-8523 for those who want to learn more about the services.
Thanks, Dr. Dalal. So I'm happy to open it up to any questions. I'm going to go with Michael Bingham first.
Thank you. Good afternoon. Dr. Dalal, who are seen as the users of the Financial Empowerment Center? Would that be individual citizens or small business owners or anybody? Or
yeah, it's designed for individual citizens and typically individuals who are facing financial hardship.
And could you tell us who are the counselors, or is there just one person? And is that a city employee, or are they volunteers?
No, these are employees. We have a mix of city employees and third-party staff that work very closely with the city employees to provide the counseling.
And what are sort of what are their credentials? How did you select them?
Yeah, sure. So they, in fact, as part of the standing up of the program, they had to go through a standardized national training that's offered by the Cities for Financial Empowerment Network, where this model originated. So they have to take that training and pass a test to be certified as counselors under this program.
Thank you.
Go ahead, Mary.
I just have maybe a clarification on, I think it was the police. The police officers or the firefighters who are at UNH, are they also not at work? Is that
I'm not sure about all of them, but I think most of them are at work. A lot of them are there for precautionary reasons,
okay?
so that they don't potentially expose their family, or if their family is potentially exposed, that they don't get the disease. I'm happy to get you more accurate numbers on that.
Okay, because you pulled up, there is another number that's definitely not at work. That was part of what you were saying.
Correct.
Okay.
Correct.
And then just a question
Which
for
is lower than the number at UNH.
right, for Director Bond.
Hi, Mary.
Hi. I just wanted to go over the I think the numbers that you gave for Mary Wade.
Mm-hmm.
Yes, there are two facilities. I wasn't quite sure about that. Maybe you could just those
With
numbers.
Mary Wade, they have a residential facility and skilled nursing facility site, which are both being affected by COVID-19.
All right. Could you do the numbers again? I'm sorry. I just want to make sure I got them right.
If it just for the sake of time, I'm going to send them to you if that's easier for you.
That's fine. And just generally, I mean, the numbers that you give for the nursing homes are really valuable. Instead
Thank
of
you.
waiting for the state. I know. Are you just going to you're going to do the same thing, or you're just going to give the numbers once a week?
I'm gonna try to update you as often as I can. We did send a memo on trying to ensure that we monitor them daily for the data. So as I get the data, I would certainly be happy to share it.
That's great, because I mean, it's a better source actually than waiting for and there's so many, it's something that really should be everyone should be on top of. So thanks for doing that.
Agreed. And Director Bond and I feel that given the increase in patients that are COVID positive, that it's important to be more proactive about sharing information about what's going on.
Right.
Yeah.
We're always aware that our information is not perfect, that there's oftentimes a delay in between when the case may happen or get tested and our data are having the data, but we're happy to share what we can, given that
Yeah.
caveat.
We did issue them a memo for clarification. The numbers we noticed at the state were lower than the actual numbers, so we did issue them a memo informing them of the importance of sharing the data, so that we're all on the same page. So there is a variable of the data, so we want to just make sure that there's a disclaimer of that.
Exactly. I mean, your data is better, so that's why we want it. We want it. Thanks.
Thanks, Mary.
You're welcome.
I see Brian had his hand up.
Yes, Brian did like the Fox 61 News. I wanted to talk with Director Bond, if you wouldn't mind.
Of course.
We'll talk about the testing capabilities that we have in New Haven and why is it so important right now in this point of the pandemic? And then the second part of the question is, does this help you all with contact tracing? And if we could possibly explain that for our viewers.
First and foremost, we've been from the very beginning working diligently on identifying positive cases, really trying to get individuals into isolation, and also contact tracing. And so we are in the phase right now within the community-wide spread, and we want to ensure that there's access to testing. As you know, when the pandemic first occurred, there was very limited testing. And so there's been a rollout of additional testing sites since the early on in the pandemic, and we are now looking at expanding even further to ensure that people have that we know where the positive cases are, so that we can then be able to ensure that people are isolating and we are containing the virus as much as possible. Our contact tracing process really consists of a robust model of just making sure that we have a group of volunteers that are assisting us in addition to our internal infrastructure within our workforce of 15 public health nurses, as well as medical students, PA students, nursing students, and public health students within the Yale University student body, where we identify the positive cases and then conduct interviews so that we can then do contact notification of any additional individuals that may have been exposed. We always provide our hotline as a means to loop them back. So if they have a need, they have that resource available to them. So we also have a hotline, which is 203-946-4949, which we make available to assess symptomatic individuals and also get them access to care should they need it. So we have a good relationship with our 2 community health centers where we work in conjunction to really try to ensure that people get connected to care. And we're also now looking at looking beyond the short-term testing solution to also have other testing sites. And so we're trying to have preliminary meetings with our community health centers and another entity to see if we can expand testing further.
So would it be wise for me to tell my viewers to go ahead and start, if they do start feeling sick, whether it be from the flu or from actually COVID, to at least go ahead and start writing down a list of people, of names of people that they have contact with in the past 14 days or so?
So what's important to recognize currently, right now, the message that we've been saying to individuals is to stay home, stay safe, to try to have minimal contact with individuals as much as possible, unless it's your core household members, so that you're not exposing yourself in congregate settings. So we want to make sure that we clarify that, but we want to make sure that individuals are cognizant and just keep in mind of who they are around, so that should they start having some type of symptoms, they will need to track 48 hours before the onset of their symptoms of who they came in contact with, and making sure they have their contact information so that we can then be proactive in that way.
Gotcha. And my last question goes towards Mayor Elicker. When it comes to having one of the first nationwide rapid testing sites in the country, what does that speak to as far as our capabilities for testing goes in the city of New Haven and Connecticut in general at this point?
Well, first of all, I think it says something about the leadership of the governor that testing is prioritized. It's very clear from so much that we've heard from epidemiologists that testing coupled with contact tracing is the key to getting the virus under control in the long run and the key to our ability to open up. But it also says something, I think, about New Haven. It makes the statement that New Haven welcomes everyone and supports the region when we're facing times of crisis. When I was at the site today, it was clear that there were not just New Haven people at the site, there were people from all around the state that are coming to New Haven to get tested at this site to help us get this virus under control. New Haven is a city that wants to step up and support our neighbors in these times of crisis, and I'm proud that we can do that with this site.
Thank you both.
Thank you. I saw Sam.
Can you hear me now?
Could I also ask, oh, I'm sorry, go ahead.
Sometimes there's I unmute you and you don't unmute yourself, then
Yes.
I think there's something wrong and try to unmute you again just as you unmute and I mute you.
Got it.
It's a little bit too much information, but let's move on.
Never too much information for a journalist. I also had a question, Director Bond, on the Mary Wade numbers. If you could also send those to me, I had a little trouble understanding that too. And
I will send it to Gage, and he will make sure to get those to you and Mary.
Okay, thank you. And the Mayor Elicker, you said 19 firefighters out of work, 11 police out of work. Does out of work mean quarantining with potential symptoms, or what does that mean?
It's a variety of different things. It can be someone that is waiting for testing results and has been exposed. It's someone that's being overcautious because one of their family members has been exposed. It's someone that has tested positive and is staying out because they don't want to infect other people.
I see. But are those all coronavirus related, or is it also just someone?
No,
who has...
those are coronavirus related.
Okay.
Yeah. There may be other officers out that are, say on vacation or sick leave or something like that.
But those aren't counted in those numbers.
Correct.
Do you have data on how many tests are being conducted in New Haven in total?
So we've started collecting that data and really tracking it. We know that the number is not not a complete picture because there are delays and lag time with getting all of the test results in especially within the negative numbers. So we do have an idea of that. It's just trying to share that we know that there's some discrepancy with that data. So the mayor and I we'll review and reassess that and perhaps share that in a future press conference.
Okay. I also had a question for Chief Dalal. You said that the city is using city staff and then also outside experts. Has the city contracted with anyone to provide those services?
This is from a grant, and the way that the money flows is the grant comes to the Connecticut Organization for Human Services cause. They provide part of the staffing for financial services, and then the city provides the other part of the staffing.
I see.
I believe there's a total of 4 financial counselors available between those 2 staffing models.
I see. So 4 meaning some from outside the city, and then
some directly working for COHS,
okay.
and some directly with the city.
Okay. How much was the grant total?
I don't have that information right in front of me, but I can get that to you.
Okay.
But it's a long-term grant, correct? It's not specific to COVID. It's just that we're having the individuals that were previously providing general financial support now add to their portfolio support regarding COVID. That's correct,
Okay,
Dr. Dalal?
That's correct. Yeah.
Okay. Thank you.
Okay, see Mary.
Did you get any information of how many people actually went through the testing site yesterday? Of course, that would be all over the state, I guess.
Rick, I think, has that information. It's over 600, right, Rick?
I believe it was 630.
Okay. Thanks.
You're welcome. Any other questions? Going once, going twice. All right, thanks everyone. Oh, one more thing before we go. So we're gonna take a day off tomorrow from the press conference. As always, you can find me at 203-500-2969. Feel free to reach out if you have any questions. Thanks everyone, take care.